Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with a left-sided ear infection. They've been symptomatic for the last fortnight or so, and their symptoms included a blocked sensation in their ear, reduced hearing, otalgia, so that's a medical term for earache, and tinnitus. They visited their GP a week or so ago, and they were prescribed some antibiotic ear drops, and the antibiotic ear drops also contained a steroid which helped the patient felt reduce their inflammation that they were experiencing, and they felt they was really swollen and tender. However, they still felt blocked, the hearing loss was still present, and they were still experiencing their tinnitus. Their GP had prescribed another bout of these antibiotic ear drops that the patient was due to collect later today from the pharmacy. However, they were recommended to have their ears cleaned out prior to using the antibiotic drops, so it would allow the drops to penetrate and make contact with the skin. When you've got all this debris, sometimes the drops doesn't make contact with the canal wall itself, and so therefore they were less effective. Now, as soon as I entered the ear and started to remove some of this debris, I just wondered whether it was a fungal infection. We call that a fungal ear infection otomycosis. And in particular, I felt it was a strain called Candida. Now, when it comes to fungal ear infections, the most common strain is Aspergillus niger. And the common landmarks with Aspergillus niger are fungal spores. They can either be white or black, alongside woolly strands. So Aspergillus niger is very easy to distinguish and to diagnose. When it comes to Candida, it's a bit more difficult because sometimes a bacterial ear infection looks similar. You get kind of a creamy discharge, but I just felt this was a fungal infection just because it was a bit more, it was just a consistency. It was a bit more smudgy, a bit more like mashed potato, and there was some kind of black moles almost embedded within the creamy discharge. And just in my experience, this appeared to me more Candida. And as soon as I mentioned that to the patient, they informed me that they do suffer from Candida in other parts of the body, and it's a chronic problem. So I explained to the patient that I was going to write to their GP because I would recommend they undergo an ear swab just to diagnose whether they've got a bacterial or fungal infection, and which will enable them to receive the right treatment. If this patient's got a fungal ear infection, they're prescribed antibiotics, it can actually make their fungal infection worse, and that's because the antibiotics they can of course also affect healthy bacteria in the ear, and healthy bacteria in the ear help to prevent harmful fungi and bacteria from colonizing the skin flora. So the skin flora is an ecosystem that lives on the skin surface that lines the ear canal and the eardrum, and if you using antibiotics, it allows the fungi to just colonize more and reproduce. It hasn't got any competition. The competition has been defeated by the antibiotics. So using antibiotics for fungal ear infection can exacerbate their infection. Similarly, if you have a fungal infection and you put olive oil drops or spray in the ear, that can also worsen it because the fungi can feed off the olive oil. So one of the main symptoms of fungal infections is psoriasis, which is an itchiness, a severe itchiness in the ear. That you can also develop that with a bacterial ear infection, of course, but it's most common with a fungal infection. So I've advised the patient that I'm going to refer them to their GP so they can take an ear swab and get prescribed the appropriate medication, but I'm pretty sure it is fungal. So it is quite a tedious procedure. We're just trying to remove as much debris as we can. A lot of this, as I said, the consistency just makes it hard to suction because it's a thick, dense, mushy consistency, and that can clog up the suction tube, and it's very hard to vacuum it all off because a lot of it still smears and stains the canal wall and the eardrum. So you are still going to see some debris there, but we've removed quite a significant amount already. They have got some debris at the top of the ear canal and also some in the anterior recess. This patient has got quite a bendy, twisty ear canal, and they've got a prominent anterior recess. So what's the anterior recess? As we approach the eardrum, the ear canal narrows and then it widens again, and it normally widens on the front section of the ear canal. So we call that the anterior canal wall, and at the floor of the ear canal. So we call that the inferior recess, so the inferior canal wall. And when the ear canal widens, you get these two recesses, as I mentioned, the inferior recess. So it's like a trench at the bottom of the eardrum, and an anterior recess. It's like a little opening, a cavity, a widening adjacent to the eardrum in the front section of the ear canal. And quite often you can get debris there. With a microscope or an otoscope, commonly you won't be able to visualize inside the anterior recess. So if there is debris there, you're none the wiser. With an endoscope, however, you can see everything. If you hold the endoscope correctly and you get it at the right angle, you can actually visualize inside the anterior recess. So you will see me going back in there. There's a bit of debris there, and it's unbeknown to me at the moment. So I'm just mopping up more at the entrance, and the outer layer of skin in this patient has, in some regions, that region I just removed there, it has been breached. The epidermis layer has been broken down because of the infection. So you just have to be really careful because the surface of the ear canal is very sensitive. So I'm going to now try and get into the anterior recess. So I've bent the suction tube ever so slightly. I've got a kink in it, so the kink is moving from right to left, and that enables me to curl around the anterior canal wall. We don't want to make contact with the ear canal to the left. And I'm just getting into that blind spot, and you can see the eardrum moves slightly. So when I was suctioning, the suction power got a hold of the eardrum, so the eardrum got sucked in, and then when I let go, it sucked back out. So it kind of just tells me just to leave that area now. I think there's a bit of debris there. I managed to remove that still, but we've got to be careful because whenever we're working close to the eardrum, we don't want to perforate the eardrum. The eardrum is a lot more resilient than people imagine it would be. That doesn't mean that it's indestructible. It is very fragile, but considering it's 0.2 millimeters roughly in thickness, it's a lot more stubborn and resilient than one would imagine it to be, being only that amount in thickness. So I'm just going to the top part of the ear canal now. So I'm just trying to move as much debris. The patient was comfortable, and when you've got an infection like this, the more debris you can remove, the better it'll be. Never going to be perfect. We're not going to get rid of that speck. I'm trying to go up into the canal wall. You can see there's still a bit of swelling there in the midsection. The ear canal is a bit swollen. There's a bit of edema, and that's meant that some of the cartilage is kind of obstructing the debris behind that. So I've just using the kink I generated in the suction probe to kind of angle the suction probe up into that opening. And now I'm just mopping up near the entrance. You'll see a before and after shot in a moment. I've advised the patient to avoid water. It's possible that the patient did get water in the ear, which then led to the fungal infection. Getting water in your ear is really bad. Now, it could be that if you have 100 people and 100 people got water in the ear, it will only affect 5%. But if you're part of that 5%, then it can lead to an ear infection. And it's hard to predict those individuals who would get affected, because if your ear is dark, warm and moist, it's a perfect breeding ground for bacteria and fungi. It's a perfect incubator. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.